Hello, my name is Vladimir Tomjlenovich, AtlasPROfilax instructor and the director for North America. I graduated at the Ackerman Chiropractic College in Sweden, in Stockholm, and now I'm working as an Atlas Prof and a trainer in America. A little bit of my background, I worked in Croatia before I moved to America, and we had a lot of very interesting results there. We did volunteer work with the Multiple Sclerosis Society. We had great results. All this was televised on the local television there. Everybody had drastic improvements. All of our patients had drastic improvements after the treatment. That was interesting. In North America now, we're doing a proposal for a clinical trial study with the Parkinson's Foundation, the Michael J. Fox Parkinson's Foundation. We have very good results with Parkinson's. There seems to be a direct cause and effect with Parkinson's. So we're pretty excited about that. The idea of adjusting the atlas is not new. Chiropractors have been thinking about the importance of the atlas and the correlationship between the correct position of the atlas and various ailments for a long time, so maybe for 100 years. D.D. Palmer and his son B.J. Palmer devoted his life to that. So they're definitely on the right track. They're scratching the surface of a right problem, a right situation. But it wasn't until René Schimperle in the mid-90s discovered that the atlas was substantially malrotated, and it takes a lot more than a thrust or one impulse to get it into place. And when I was at the Ackerman College, they taught us how to adjust the atlas and the axis with the typical rotation and high-speed, low-force thrust. And we did the actually we did in class we did the test. I was already an AtlasPROfilax practitioner. We did a test of doing the atlas correction by chiropractic adjustment, and there was some small improvement in the function of the atlanto-occipital joint in terms of range of motion, and there's some relief there. But that improvement was incremental, was small, and it was also short-term. So what we did is with the same students, those classmates at the time, we did the AtlasPROfilax correction, and the changes were afterwards additionally drastic. Rather than gaining a few millimeters, we gained several centimeters of range of motion, left, right, and extension and flexion of the head, as well as with lasting results, with the long-term results. So that was great. And then the president of the college was also impressed, so we did a correction on him as well. So that was very nice, Dr. Ackerman. So the idea of the atlas adjusting, like I said, it's not new, but since there's no disc between the atlas and the occiput and the atlas and the axis, what René found is that you cannot adjust it with one impulse or one thrust. He found that you have to use a specific vibrational frequency and apply an effect of structural fatigue to the muscle and the fascia, and then with that fatigue and that specific vibration and specific pressure at a specific area, he was able to achieve the structural fatigue, essentially render the area useless for the moment until the atlas adjusts. And it's fascinating that this method is completely safe, unlike many other chiropractic methods which have a long list of contraindications. Essentially, chiropractic, without any disrespect to the method, because it has served its purpose and has paved the way for us to, for René to find this new method, it has, it's very limited, because it seems like that the people that need the correction the most are not qualified because of their contraindication, whether it be osteoporosis, whether it be inflammation of a joint like arthritis, or many other ailments where a thrust, a jerking movement of a head is simply not safe, especially as we know, the elderly, we cannot safely adjust them in a chiropractic treatment. And chiropractors know this, and they have to proceed cautiously. They might use the activator or some gentle traction, but they cannot do the thrust that they're taught and that what they want to do. So with AtlasPROfilax method, we have essentially zero contraindications. Obviously, if there's a fresh injury or surgery, we wouldn't do the treatment. But there's almost no contraindications, so the method is safe for everybody and it's effective for everybody with no age limitations and other limitations, which is fascinating. So the people that need the correction the most are able to get it, not just healthy young people who can do it preventatively. We have a great team of AtlasPROfilax practitioners here in Europe, in Zurich now, and as well as in North America. We have some chiropractors and medical doctors in North and South America working already, but there's a lot of atlases to be corrected. We're looking for qualified medical doctors, chiropractors, and physical therapists who have experience and who can join us and learn the AtlasPROfilax method to include it into their therapy.